Abortion providers across the country are preparing for a dark future, the likes of which America has not experienced in nearly half a century. Someone with unique insight on that is Dr. Susan Dodd. She grew up in Gatlinburg, Tennessee, where she says her babysitter was none other than Dolly Parton. In 1972, the year before Roe v. Wade was decided, Susan became pregnant. She was just 16 years old. Her sister drove her to Knoxville to get an illegal abortion. Her experience navigating the pre-Roe world led her to become an OBGYN, providing abortion services for the people of Eastern Tennessee. Joining us now is Dr. Susan Dodd, retired OBGYN. Dr. Dodd, thank you for joining us tonight. Talk to me about your experience of seeking an abortion before Roe and how it led to you becoming an OBGYN.
It was an extremely frightening experience to have your first doctor visit with a OBGYN be asking a stranger for an abortion, which was illegal at the time. So I gathered my courage. My sister helped me a lot, and in that area also. And I asked the doctor to perform an abortion on me.
And once you became an abortion provider, you provided abortions in Knoxville, and I believe a lot of people were upset with you, turned on you. I even read that your husband had to buy you a bulletproof vest to wear to work.
Yes, that's what the FBI agent recommended. And so that's what we did. There would be protesters at the clinic that would take my license plate, that would send me letters, threatening letters, sometimes threatening my safety, mostly threatening that my religious future would be in jeopardy.
Did you ever think, back when you were a teenager, getting that abortion, going and paying all that money at that time, it was very expensive, and dealing with all of that pressure, that you would see a day in your life when we would return to a world where people may be forced to seek illegal abortions?
One of the most frightening things about illegal abortions to me was experiencing it through the eyes of my older partners. I was right on the cusp of Roe versus Wade, and I had great hope that our future would have abortion care as a part of women's care. But my older partners would describe horrific hysterectomies they had to do, just dismal situations, women who would lose their lives from seeking abortions through back alley providers.
Dr. Dodd, I wanted to ask you, the Oklahoma legislature, as I mentioned a moment ago, has passed 3 sweeping abortion bans in 2 months. Your home state of Tennessee has outlawed abortion pills. How do you think doctors like yourself will respond? Do you think they will risk arrest to keep providing necessary care?
I think most will not. I think if I was still providing abortions, I'm retired now, I would have to think very carefully about doing it. The biggest concern for me is, what are we going to do for women who have ectopic pregnancies, for women who have, life-threatening consequences to their health because they are pregnant? Who gets to decide whose life we save, or whether we'll let both the mother and the fetus die? It's a very frightening future for OBGYNs and their patients.
How worried are you that if the Supreme Court overturns Roe v. Wade, it will embolden those who want to use violence against abortion clinics, abortion providers?
I think it will come to more of a law situation where patients, where other people will say, oh, well, that doctor provided an abortion and there was a heartbeat. So then you go to court. And I think it'll be more, instead of physical violence, it'll be more legal action, which they'll have a right to do at that point.
One last quick question before we're out of time. If a Supreme Court justice or a Republican lawmaker were to ask you why Roe shouldn't be overturned, what would you say? What one thing would you say to them?
I would say it's my body, my choice. If you choose not to have an abortion, don't have one.
And they would say, if you were talking about masking, they'd agree with you. Dr. Susan Dodd, retired OBGYN and longtime Tennessee abortion provider, thank you for your time and thank you for sharing your story with us tonight. Appreciate it.
Thank you.